Well, hello to everybody. Here it's Teresa Sanderson here with another episode of Dare to Do Nursing Differently. And I have a wonderful guest with me today. She's a dear friend, Melissa Schreibfetter. And I got to know Melissa, probably about 3 years ago now. And when she was, and she's still doing work with Functional Nurse Academy and also with Christian Functional Medicine Academy. And her program was already very, very successful in the online space. But I was able to partner with her to add continuing education credit to the curriculum that she offers to help other nurses get started in this business. And so I'm excited to welcome you today, Melissa, as a guest to the show. It's an honor to have you here.
Thank you for having me, Teresa. It is so great to connect with you again.
I agree. And, you're doing something that right now is so very popular, across the country. And I think even around the world, just really helping nurses and the community in general really understand more about their health through the field of functional nursing. So I just think that's amazing. And you're kind of a pioneer in that space, I think.
Yes. So the Functional Nurse Academy started back in 2022. And, it started I originally started as a live mentorship program, and it exploded from there. Because again, and I know you can speak to this too, we become nurses because we want to help other people get better, but then we discover a sick care system, which we know is amazing with things like emergency medicine, but they're just failing the chronic disease epidemic in our country. And there are so many things that nurses can do to help people to identify what could be potential obstacles that are preventing people from healing. And we can also do that investigative work. What are some potential triggers? And then what are some implementations, whether that is lifestyle or nutrition that can be implemented to improve health outcomes.
Absolutely. I just love that because I think it's so empowering. It's so empowering, I think, for us as nurses and also for the client or the patient who's receiving that, to have that just insight into what's going on in their own body, right? Because so much about the sick care system is that we're told a lot of things, but we're not necessarily given all of the information about our health. And that's where I think functional nursing and this medical pattern is so very different.
It is. And functional medicine is evidence-based because it has been shown to reduce healthcare costs and improve patient outcomes. And, you don't have to be a nurse practitioner to open up a functional medicine business, because even if you are not advanced practice, there are ways that you can even order labs under the MD of a partnering laboratory. I teach nurses how to do that. And then you can use that data to provide education about potential dysfunctions in the body. And again, with the healthcare system as a whole, there's so many people that have very good intentions working in that system. But we also know that on average, there's about a 17-year time lag from when we discover a new finding in the scientific literature until it gets implemented into guidelines. So with functional medicine, we are actually using more up-to-date research to be able to help individuals. And nurses are the best coaches. We already are well versed in things like SMART goals. And one of the largest obstacles to individuals being able to appropriately implement an effective lifestyle plan to improve their outcome is people report not having enough supports, and nurses can fill in those gaps and provide the education, the resources, and the coaching in these areas.
Love it. Love it. Yeah. And that is so very important. The name of this podcast is Dare to Do Nursing Differently. And so I'd love to ask you, how do you interpret functional nursing and the work of the nurses that you train in your two programs? How do you equate that to the topic of Dare to Do Nursing Differently?
Yes. So the best way to explain it, as we all know in nursing in general, we wear all kinds of hats. Okay. That's kind of like functional nursing too. And again, nurses, not only are we some of the best coaches, but we are also the best multitaskers. So I explain functional nursing as it's kind of like a combination of nursing practice, case management, education, coaching, and you're even a little bit of a kind of like a private health investigator. There are so many, and really there are so many services that we can offer our clients under the nursing scope of practice. And really, we can help clients in a variety of different ways. But we know that individuals suffering with chronic illness, they report that they don't feel like anyone is listening to them, or they show up at the doctor's office and the doctor's like, your labs are normal. But then there's this whole other side. There's so many other things we can do to help them, when we are not working under the confines of insurance. And if you are not an NP and you have an MD that you can order labs under, which we provide at Functional Nurse Academy, you can actually order the most appropriate labs. We can look at a full thyroid panel. We can look at micronutrient markers. We can look at inflammatory markers. There's so many more labs that are available that can really help to uncover what are certain patterns of dysfunction, what are some, certain targeted nutritional needs for the body and things like that. And we can also use that information to create a bio-individualized wellness plan. Because again, the conventional side, it's kind of like you have this symptom, here's this med. You have this condition, here is this protocol. And I believe that God made us all unique individuals. One thing that's going to work for one person is not going to work for the next person. So that's why having these services that allow us to spend more time with the clients that we serve, allow us to order more labs, and again, really get to know that individual that we are working with. And we also see in research that when individuals have a positive experience with the healthcare professional that they are working with, they have improved outcomes. So there's really just so many, resources that we can utilize to really make a positive impact with the health of our country.
I absolutely love all of that. And as far as, thinking of daring to do nursing differently, I heard you say a couple of key things. Number one, being able to have more time with each of your clients, right? Which that's definitely different for nurses. That's very contra to what is going on in the rest of healthcare, but also the idea of doing that deep investigation into what is the root cause of this problem and not just looking for a Band-Aid type solution. So that I just absolutely love. And I think it's what the community, the American public, is ready for right now. I think they're tired of not knowing enough to take care of themselves well.
Yes. And again, like working under the confines of the insurance companies makes it so much more difficult. And when I teach nurses about starting functional medicine businesses, the demand is out there for functional medicine, and there are not enough qualified functional medicine practitioners. And it's a very good blend having a nurse, whether you are a LPN, RN, or a nurse practitioner, being trained in this area. And when we talk about the confines of insurance being a limitation. So the business formula that I teach is actually a direct pay model. However, patients can use HSAs, FSAs. We're actually now seeing health share companies reimburse for functional medicine services. And there's also ways that you can implement flexible payment plan options. But when an individual works with a qualified functional medicine practitioner, when we kind of zoom out and look at the big picture, if you work with a practitioner that helps you to get healthier, a practitioner that can help you get so healthy that you may be able to titrate off of pharmaceuticals under, of course, supervision of your provider. but just look at that, improvement in the quality of life that that individual can experience and reduce healthcare costs. And also another thing that I like to teach, and this is what happened in my functional medicine business, once you help a couple of people get well, they're not going to be able to stop telling their friends and their family about you, and then you will get to that point where you have such a strong referral base that you don't need to go and spend all of this money on marketing or anything, because if you are making life impacting changes, word of mouth will get around. And it is so rewarding when you're actually in a model where you see your patients and clients get better. It's amazing.
Fantastic. Yeah, I really love that. And, it sounds like it's so gratifying in so many different ways, the work that you're doing, just because, I think you and I've had this conversation that I had been a nurse for 25 years by the time I realized all I'd ever done was help people manage illness and disease. And that was such a sobering moment for me as a nurse, because there was no wellness. There wasn't anything about how do we get you, get your homeostasis back to where it's supposed to be? Because having 3 or 4 chronic diseases and comorbidities, that is not homeostasis. That is not what it is at all. It's health. It's being healthy and being well. And we're so far off the track on that. So I just think this is a beautiful path that you've taken. And I love that you have 2 different academies. Tell us a little bit about each one, and how is one different from the other?
Yes. Well, thanks to you, Functional Nurse Academy I am now an approved provider of continuing education. So nurses that go through FNA, they do get 90 nursing CEs. They also will qualify for multiple board certification opportunities in functional medicine. And not only am I teaching them in depth I'm not just teaching them the functional medicine modalities, I'm teaching you also how do you apply those modalities. And I also teach the business aspect. So they get very in-depth self-paced training. And then also when I train these wonderful nurses, I do not want to just be like, okay, bye. Yes, you have no access to me. Good luck. So all of our graduates get access to 6 months of free functional medicine mentorship with me, where they're able to join a live session each month. And that's a combination of functional medicine deep dive topics and business mentorship. And so it's a very comprehensive, where, I basically designed the program that I would have wanted to have when I was a brand new baby functional medicine nurse trying to figure it out. Now, Christian Functional Medicine Academy, that started because I had so many graduates from FNA that were reaching out to me, and they were saying, Melissa, my friend is a physician assistant or a pharmacist or a health coach, and they also want to train with you. So I went ahead and I got a wait list started. And what I essentially took Functional Nurse Academy, and it's essentially the same training, but I repurposed it to make it suitable for and geared towards general healthcare professionals. So the Christian Functional Medicine Academy is our sister school. Now, when it comes to the Christian content, because again, I am a believer, and I believe that we were made in God's image. So the differences between the two, I do offer a Christian content in Functional Nurse Academy. However, it is an elective. So you're not required to take any Christian content. Now at Christian Functional Medicine Academy, that content is a requirement. And then graduates from that program, they also are eligible for multiple board certification titles in functional medicine.
Incredible. So very comprehensive solutions. You're kind of that turnkey solution for people who want to get started, whether as a nurse or a healthcare provider in the field of functional nursing, functional medicine. And you teach them the entire curriculum that prepares them for certification. And then you also mentor them in business. That's amazing. That's amazing.
I really want it to be a one-stop shop because there are so many training programs out there. So I wanted to be a one-stop shop where they can get everything that they need to be able to get up off the ground and running, and then also have that continued support along the way.
Fantastic. Way to serve. I mean, that's kind of the thing with business. It's business can be so simple. Find a need and fill it. And I think when we listen to our audience as you did, it's, what are they going to need to be successful? And that's what they want. I love that. I love that. So tell me now, innovation, getting started in any business or anything new takes a lot of courage. So what fears or obstacles or resistance did you have to overcome to make your way on this path?
Well, my biggest obstacle is time. Before we started recording, I was telling you about how I had two back-to-back babies and I have an older child. So I am a mom working from home with all of these children, so it really on my end, it has been priorities. Time management is huge. So, but I will say just a blessing about being a business owner is, being in control of everything. I don't have to go work for some large heartless corporation like I used to, that I'm just a number to them. I have my own business. I'm able to structure everything. My biggest obstacle being the time limitations, I'm able to sit down and work on automations, working on delegating things to my team to make it more manageable.
Oh my gosh, I love that. And so you're speaking just so much wisdom in all of that, and for anybody who's out there, anybody listening who is a mother of young children, or maybe you're more in my space where maybe you're taking care of aging parents or something like that. But I want you to hear the possibility here, because when you take your passion and you decide to pour into it and start this business to serve others, as long as you can become the CEO of your calendar and really own your time, it is possible. And I just love hearing that, Melissa. You've got these two babies, as you said, back to back. And what a beautiful thing that you're able to be there with them and still grow and work this amazing business.
Yes, it really is a blessing. And with my first baby, a long time ago, I was working in the hospital and I was like, I'll just go back part-time. Well, I missed his first steps. And then I was also like, well, I'll do 8-hour shifts, not 12-hour shifts. Well, then with the commute, I'm gone for 10 hours a day. So this is a really wonderful integration, because my office is right here in my house. My kids are in the other room and I don't have to be away from them for an extended period of time. And mom is always home. So because before, when I had to work away from the home, I felt guilty and I felt like I couldn't do all of these things well. But I can confidently say that I have figured out the work-life balance situation. And it is wonderful when you get to this point.
Oh my gosh, that's just amazing. I love hearing that. Let me just say, impact is at the heart of what nurses want to do. And it's definitely at the heart of what you're doing with FNA and Christian Functional Medicine Academy. In what ways do you believe your work is creating change, whether that's for nurses, for patients, or for our healthcare system as a whole?
Oh, yes. So many different ways, but let me go ahead and condense that. So when we talk about nurses, I really do believe that nursing is probably one of the least satisfied professions out there. And the way that nurses are treated in the system, it's terrible and it must change. And, there's really not a lot of professions that treat their employees this way, where we're so overworked. We're put in situations, honestly, that are dangerous, where we're so understaffed. And then heaven forbid, you are exhausted because they're working you to death and understaffing you. And heaven forbid, you make there's a sentinel event. You make an error,
Yes.
you then can be criminalized for that. I mean, what is this? And the system, I think, is not going to change unless we force it to change. So, that is also one of my objectives, is to change the healthcare system for positive moving forward. And I really do believe that by helping nurses be able to exit the sick care system and get set up in concierge practices where they can do what they do best and properly serve their client or patient population and actually help people to get well to where they don't end up having to be hospitalized and things like that. Because there's so many people that are in and out of the hospital for preventable reasons. Now, I think that putting nurses in that role where they can really work on chronic disease prevention and then work on the functional medicine side and help people to actually heal will have so many benefits, so many positive ripple effects. And then also, when you hate your job. I remember not being able to sleep before a shift because I was so anxious about having to go back into that god awful workplace. And I also think that brings so much peace and also purpose. And, for me, with my beliefs, I do believe that God gives us gifts in this world. And I feel like there are so many people that are not able to properly live the life that they are supposed to live because they are struggling with chronic illness. And once you help your clients recover their health, which I've had individuals I've worked with 90% plus remission in all of their symptoms within 4 months. Like, healing is possible once you help transform someone's life. That it is the most rewarding job that you can have. And it is wonderful. With nurses, we go into it to help people. We don't want to go and just be giving people pharmaceuticals for everything. And then we continue to see the people get worse and worse. So it is really amazing, shifting from that sick care model to whenever I see my clients now, they're better. And it really, there's with nurses having, we are the largest healthcare profession out there. The more and more nurses that are practicing this way, that is more just effective change that's going to trickle down from that.
Oh my gosh, I just love hearing all of that. And I think, it just brings to mind a couple of years ago, my husband and I took a cruise to Alaska, right? It's one of these, I don't know, it's like a bucket list kind of experience. But anyway, as we were there in the cruise, there's the elevator line, and it was full of people with walkers, scooter chairs, all these kinds of things, and people that couldn't get around well. And it was frightening to see because they just waited too long to take this trip of a lifetime, right? But I thought, what a picture of the health of our country as well, especially of our aging population. It was just, it really took me aback to see all of that.
Yes, well, and there are so many individuals, and to give you an example, I'm not sure how much you know about my backstory, but I was a chronic fatigue sufferer. I had chronic Lyme disease, and that's actually how I learned about functional medicine. Is I finally found that good provider that listened to me and diagnosed me, and it was that functional medicine approach that changed my life. I was chronically ill for years, and I'm not chronically ill anymore. And again, I feel so good. I was like, let's have back-to-back babies at 40. So, but, I do see in individuals, and it really, I think it's also lacking on that informed consent status. People get diagnosed with conditions, and they are not told that there could be additional alternatives for them through functional medicine modalities. And as nurses, we're some of the best coaches and educators, and we can really help to get that information out to people.
Oh my gosh. I could obviously talk to you about this, I think, forever. But I know we're limited today. And I want to give you an opportunity, Melissa, to share with our audience and all of our viewers and listeners, how can they connect with you? How can they learn more about Functional Nurse Academy, Christian Functional Medicine Academy, so that they might connect with you? The floor is yours, girl. Tell them.
Yes, absolutely. So if you are a nurse and you're ready to leave that sick care model, feel free to reach out to me. So you can contact me multiple different ways. My website is functionalnurseacademy.com. You can reach out to me directly through there. All my contact is listed on that website. You can also follow me on social media. My handle there is also Functional Nurse Academy. I also think it's really important, if someone is interested in enrolling in my program, I think it's important that you have that opportunity to at least meet me and ask me any questions that you have. So also on my website, you will see that every 2 weeks, I go live and I do an informational webinar where I meet with all of the nurses who are interested in enrolling. And I show you the behind the scenes of my course platform. I talk about how you can use functional medicine under the scope of nursing practice. And they, at the end of the webinar, for at least the last 30 minutes, I open the floor up just for live Q&A. So that's a great opportunity to speak with me live. And again, I'm very receptive to emails. If you have any questions for me, I'm happy to get right back with you. And then also, if you are another healthcare professional, you're not a nurse, then you can reach out to me through Christian Functional Medicine Academy, which that is christianfma.com.
Love that. Oh my goodness. So much great information. And I want to thank you again, Melissa, for making the time to join us today to share with nurses more about what it is that you do, because I believe, as you do, nurses are ready for something different. They're ready for something more, and they deserve something more. So you are an example truly of daring to do nursing differently. And I want to congratulate you on all of your success that you've had so far, and wish you abundant success in the future as well. Thanks again for joining us today as our guest.
Thank you, Teresa.
Yeah, absolutely. And to all of our viewers and listeners, this concludes this episode of Dare to Do Nursing Differently. We will see you next time. Thank you. Bye for now.